My name is Alma and I'm married to Bastian, and we have a beautiful 2-year-old boy called Xander. We also have a 4-year-old golden retriever, so he was our first baby. I work part-time as a tax director, and I am a full-time mammy, which I absolutely love. So when I was 35 and 10 weeks pregnant, I started to experience some lower back pain, and initially I just put it down to my body changing with pregnancy. But very quickly it started to get quite bad, and I remember I first started to feel the pain on a Wednesday, and I was working from home. I remember actually lying down on the ground to try and get some relief from the pain. And by the Friday evening, it was really bad. It was, I was struggling to kind of move. And I remember getting ready for bed and looking at my right leg, and my right leg actually looked a completely different colour. It was almost blue, and my foot and my leg were a little bit swollen. And then Friday night into Saturday morning, I woke up in the middle of the night with the most excruciating pain, and it had kind of moved from being kind of at my lower back to moving down my inner thigh, into my knee, into my calf. And I actually remember trying to get out of bed, and I could hardly stand up. And I woke my husband, and I was really scared. How had this back pain suddenly gotten so bad so quickly? So we decided to ring the on-call GP. Called them. I explained my symptoms, and they said that they would have someone call around me as soon as possible, but that they were busy. So an on-call GP called to the house on Saturday morning, and by this stage, my husband had to help me come down the stairs. We actually had a pair of crutches in the house, so I was using those. And the GP came, he asked me about my symptoms to explain them. He looked at my leg, and he said that I had sciatica. So as I understand it, sciatica is a lower back pain that tends to the pain extend down into a leg, and it can be on one side. And he just said to me, because you're pregnant, there's not a lot you can take in terms of pain relief, but if you feel you need to, you can take paracetamol. He recommended that I try to move as much as possible to kind of release the nerve in my back, and he recommended using a hot water bottle for the pain, and that if maybe going to a physio might actually give me some relief. So I made an appointment for a physio on the Monday. And over the weekend, I didn't improve. I was getting worse. The pain was really, really bad. Nothing was giving me any relief. And by the Monday morning, just something didn't feel right. Of course, I had Googled sciatica, and it can be happen during pregnancy, but everything I was kind of reading was suggesting it happens later in pregnancy. So I decided to ring my own GP, and I explained to her that I had been seen by an out-of-hours GP, and I explained my symptoms, and she said, come in and see me as soon as you can. So I went into the GP, and she looked at my leg, and almost straight away she said, I think you have a clot. I mean, this was completely a shock to me. I had never, the only thing I knew about clots was that if you went on a flight, a long haul flight, some people wear stockings to prevent a clot, but I knew nothing about signs or symptoms, and I certainly did not know that being pregnant would increase your risk of getting a clot. So my GP measured my calf at that stage. It was 7 centimetres bigger than my left calf, and she referred me to the maternity hospital because I was pregnant, and my main concern was our baby. Would our baby be okay? Would this impact our baby? And so I went to the maternity hospital. I was at this stage in a wheelchair because I just couldn't walk, and pretty much straight away I was seen and given an injection of blood thinner, and they did a scan to check baby, and everything was well with baby, heart rate, everything was fine. So that kind of alleviated a bit of our worry. But then I guess I was really worried for myself and what would happen next. And at that point then I was referred to a general hospital, A&E. So I was sent to an A&E department in a general hospital, and it's hard to even remember now, but it was during the midst of COVID. So there was a separate A&E for non-COVID and an A&E for COVID. And the A&E was so busy, and at that stage, I needed a wheelchair because I just was not able to walk anymore. When I got into the A&E first, I was waiting on a chair, not for too long. I was triaged by a nurse pretty quickly, and she told me that they were going to do some blood tests to check something called a D-dimer level as an indicator of the presence of a clot. I still didn't really know what that even meant, and from there I spent a lot of time sitting on a chair in the A&E waiting room, either in a chair or a wheelchair, and the pain was excruciating. I was finding it difficult to move. I could hardly make it to the bathroom at that point. So I was moved to a bed inside A&E, and there were some doctors that asked me some questions, and nurses as well, about family history of clots, and the nurse kept saying to me, keep your leg, they put cushions under my leg, keep your leg elevated on the bed. It was just so painful, and I had this natural tendency to want to put my leg down on the ground and bend it because it felt better that way. They kept telling me to elevate it, and I didn't really understand why. And after, I think, a period of about 24 hours of waiting, I was sent to have a chest x-ray. And after the chest x-ray, which happened I think in the morning, I had an ultrasound on my leg late that afternoon. And I remember the ultrasound so well because I lay down on the bed, and the person performing the ultrasound took the kind of wand that they use, and when she pressed it on my leg, I was crying. I was in so much pain. I just had never experienced the like of it, and I just wanted it to be over. I just wanted her to be finished, and it felt like it took an age to actually get it done because I was in so much pain. My leg, my thigh, my calf was huge. It was tight. Every movement of it was excruciatingly painful, and I was really, really scared, and I was really worried about what was going to happen to me and what might happen to our baby. I was then brought back to the ward that I was staying on, and very quickly there were a few people in white coats standing around me, kind of introduced themselves as a hematologist, a vascular consultant, and there was a general consultant there as well. And they explained that I had a significant DVT, so a clot that had originated in my right calf, but had travelled up the vein and into my vena cava. And that completely shocked me, and I had so many questions. How did this happen to me? What can be done to fix it? And what was really important for us was, will it impact my baby? Will our baby be okay? And I suppose one of the reasons that the well-being and health of our baby was important as well as was because we'd had a miscarriage a few months previous, and it's a very, very hard thing to go through. And so on top of me being unwell, we were concerned that maybe something would happen to the baby. So I suppose the next steps then were for them to talk to me about potential treatment options. So I had mentioned that I was given a blood thinner injection when I first attended the maternity hospital. So I was continuing to get blood thinner injections. So one of the options available, or that was explained to me, was something called, I think, a thrombolysis, which would mean administering a much higher dose of blood thinner to essentially break up and flush the clot out of the vein. But there were risks associated with that. Because the clot was so significant, there was a risk it might not actually work. There was a risk that it might partially work, but I could be left with mobility issues. And a thrombolysis, that flush of blood thinner, may also risk the pregnancy. And so when I heard that, it was like, no, there has to be something else. And as well, all I could think about was, we're going to have a baby in 8 months' time. If I have mobility issues, how am I going to be the mother that I want to be to him? So the vascular consultant mentioned that there was another option called a mechanical thrombectomy, and it was something that had been carried out by a consultant in the Mater Hospital, who I believe that consultant had done a number of those procedures when he was working in the States for a number of years. And she asked me, would I like would I be happy for her to reach out to him? And I suppose my question around that was, well, how does that differ from a thrombolysis? Does that reduce the risk of that's associated with terminating the pregnancy? And so she explained to me that there would be very little risk to the pregnancy associated with the mechanical thrombectomy. There were risks associated with it, but when I heard that the risk was minimal to the pregnancy, if maybe not even a risk at all, I said, yeah, let's talk to this guy and see what he can do. So I met him and he explained what a mechanical thrombectomy is. So it is, in the most basic way that I understand it, it is this instrument that they make an incision at the back of your knee, and for all the world they push it into the leg and pull out the clot to get rid of it. And like I said, there were risks associated with it. You know, I don't think it ever gets rid of all of the clot. There will be potentially still some particles of the clot left in there. But myself and my husband had a good chat about it, and we decided to go ahead. So a week exactly to the day from when I first went into A&E, I had that procedure. And the procedure was really, really, really tough. So as I said before, it was COVID, so my husband wasn't in the hospital with me. I was on my own. In terms of pain relief that they could administer, it was limited. It was mainly IV paracetamol. I lay on my belly, which I still could because I was just 10, 11 weeks pregnant at that stage. And there were two really, really nice, kind nurses who stood at the end of the bed. One held one hand and one held the other. And they said, just squeeze the life out of us because this is going to hurt. And like, with the passage of time, you forget pain. But I just remember thinking, I've never experienced anything like this in my life. It's like some form of torture. But it felt like a long time, but it was quite quick. The procedure was carried out was done quite quickly. And then afterwards, I was taken out of the theatre and I was waiting to see the consultant, and I was worried. I was scared. I remember calling my husband saying, it hasn't worked. I've still got loads of pain in my leg. My leg is still swollen. I was panicking. I was freaking out because to me it felt like it hadn't worked because I was still experiencing pain. And I think the shock and everything of having experienced that pain without pain relief had really kind of taken its toll on me too. But once I spoke to the consultant and he showed me a picture of, you know, the clot. It's out. Most of it is out. It's been a success. You'll have a bit of pain, but that will go away in the next 24 to 48 hours and you will start to see the swelling come down in the leg. And he said to me, what's really important for you now in terms of your recovery is to remember ABC. So A, try to be as active as you can to promote the blood flow throughout the vein. B, blood thinners. So I was on blood thinner injections twice a day for the duration of my pregnancy and for 8 weeks after. I'm a total needle phobe. So my husband had the honour of injecting me twice a day for the duration of the pregnancy. And then C is compression. So compression stocking, to wear a compression stocking for the duration of the pregnancy as well. Then in June 2022, we had our baby boy, Xander. Unfortunately, the pregnancy, the birth itself didn't go quite according to plan. Throughout the pregnancy, I had regular consultations with a haematologist. So we had a plan in place that I would need to be induced. And of course, I went into the maternity hospital, I was induced, and things weren't going well. The baby's heart rate was dropping when I was having contractions. And again, another really scary time. I wasn't sure what was going on. And my consultant said, Alma, we're going to have to do an emergency section. It's almost 3 years now since I was first diagnosed with the clot. So why am I sharing my story now, 3 years later? I suppose it's taken me time to actually, you know, come to terms with what we went through as a family, what I went through. And I'm now at the stage where, you know, I understand more about clots and I understand the risk of clots in pregnancy, and I want to be able to share my story with others. And I suppose the reason I want to share my story is that when I was pregnant, I had no idea that I was at an increased risk of getting a clot during pregnancy. I had no idea. I didn't know what the signs, what the symptoms were. I was healthy, I had a good BMI, no family history of clots. And I mean, if if someone is looking at this video, if they can take one thing from it, I want it to be, just to be aware that if you are pregnant, you are at an increased risk of getting a clot. And some of the signs and symptoms can be different, but I suppose the big sign for my clot was the swelling in the leg, the pain in the leg, and they were probably the signs that, had I known that a pregnant woman would be at a higher risk of a clot, they're the things that probably would have set off a red flag in my mind to go and get checked, and maybe even to say to that out of hours doctor, could I have a clot? Because I saw that doctor on the Saturday. It was the Tuesday before I was scanned. Those few days could have made a difference. I'm incredibly lucky, I think. I trusted my gut, and I still do that as a mother. And I called my GP on the Monday morning, and she effectively saved my life. The outcome could have been very, very different if I hadn't called her. I probably would have just sat it out at home and waited for that pain to go away. And as I said, it's not even worth thinking about what could have happened. And I'm, so grateful now that 3 years on, I am well, I'm alive. We have a beautiful little boy who is a busy 2-year-old, keeping us on our toes. And I'm grateful to all of the consultants who helped me get through this, and to the consultant that suggested the mechanical thrombectomy, and to my husband and family and friends who were also supportive throughout the whole ordeal. So that's why I wanted to share my story today. And another thing that I, wish I had been informed about or made aware of is that the support that's available from Thrombosis Ireland. I think, every patient who has a clot, who's suffered from a clot, who's showing signs of a clot, should be made aware of the support that's available through Thrombosis Ireland. When I came across Thrombosis Ireland through Googling, and got onto the website and was amazed to see, wow, there are lots of people who have stories just like mine, and they're sharing them, and everyone can learn something from someone's story. The website is so easy to navigate. I have a card in my wallet that I got from Thrombosis Ireland to spot the signs. I carry that with me all the time. I think every GP surgery in Ireland should have, every hospital A&E waiting room should have those cards available for patients to know what to look for and what signs to spot for a clot. It's an invaluable resource for patients who have suffered from clots.